Keep moving with Sinai Health, safety of exercise during pregnancy. What activities are safe to participate in while pregnant is a common question asked by many families at the beginning of a pregnancy. Often, this includes whether it is safe to exercise while pregnant. Contrary to previous beliefs, women are recommended to exercise throughout their pregnancy. Despite this, less than 15% of pregnant women actually achieve the minimum recommendations of exercise. One reason for this are concerns about the benefits and safe methods of exercising. This video will answer common questions including, is it safe to exercise during pregnancy? What are the benefits of exercising during pregnancy? What are the current recommendations? And how can you stay safe while exercising during pregnancy? Let's begin by talking about safety. Is it safe to exercise while pregnant? The answer is yes. Exercise during pregnancy does not harm the health of mom and baby. Scientists have found no link between exercise and pregnancy complications. These include, but are not limited to, miscarriage, stillbirth and preterm birth, labor and birth complications, and fetal death. In fact, not participating in exercise can increase the chances of developing pregnancy complications. Some of these include, but are not limited to, high blood pressure, mood symptoms, and diabetes. We'll get into these later on in the video. So, exercising can actually improve the health of mom and baby. Who can exercise during pregnancy? Most women can exercise safely during pregnancy. It is safe for most women to exercise while pregnant. This includes women who were previously active, who have been diagnosed with diabetes during their pregnancy, or who have been told by a doctor that they are overweight or obese. However, please note that there are situations when pregnant women should not engage in exercise. If you have any of the following listed conditions, please speak to your doctor before participating in more vigorous activities: leakage of fluid, early labor, blood pressure concerns in pregnancy, multiple pregnancy, such as twins or triplets, diabetes in pregnancy, and other serious cardiorespiratory and systemic disorders. Women with the following conditions should also ask their doctor before participating in exercise activities: recurrent pregnancy loss, a history of spontaneous early delivery, eating disorders, and any other significant medical conditions. Overall, it is safe for most women to exercise during pregnancy. However, it may be unsafe if women have any of the medical conditions previously described. When in doubt, please ask your healthcare provider. Not only is exercise safe, but it can also improve the health of mom and baby. First, exercise can lower the risk of the baby being born with complications. Second, exercise can improve the mother's health. Exercise can lower the risk of pregnancy complications, including, but not limited to, high blood pressure in pregnancy, diabetes in pregnancy, cesarean section, excessive weight gain in pregnancy, high blood sugar, mood symptoms, and pelvic pain. In fact, the more exercise you participate in, the greater the chance of improving your health. As you can see, exercise has positive impacts on the health of mom and baby. Now that we know that exercise is safe and beneficial, when and how should you start exercising? When to start exercising? You can continue or begin to exercise as soon as you become pregnant. Women who did not exercise in the past can begin exercising during pregnancy. If you are new to exercise, start slowly by doing short, low-intensity exercises. This can be as little as 10 minutes of exercise, such as a slow to quick walk or low-intensity workout. Next, increase the intensity and time of exercising gradually throughout your pregnancy. Women who exercise before they were pregnant and have an uncomplicated pregnancy should be able to continue their exercise routines. However, always remember to check in with your healthcare provider. Now let's discuss the 4 main recommendations of how to exercise while pregnant. First, pregnant women should accumulate at least 150 minutes of moderate intensity exercise each week. How do you know you're doing moderate intensity exercise? You can measure this using the talk test. In moderate intensity exercise, you should be able to talk while exercising. In vigorous intensity exercise, you will find it hard to breathe and talk normally while you exercise. Always aim for moderate intensity exercises during pregnancy. You can ensure this by exercising at an intensity where you are breathing a bit heavier but can still carry on a conversation. Second, exercise should be accumulated over at least 3 days per week. Your goal is to achieve 150 minutes of exercise per week. Exercising a little every day is a perfect way to meet this goal, but remember, exercising a minimum of 3 days per week is recommended. Third, aerobic and resistance training is highly encouraged. Adding yoga or stretching may also be beneficial. It is ideal to participate in a variety of activities. These include aerobic exercises such as walking, aerobic dance, swimming, cycling, rowing, or jogging. You should also consider participating in resistance training twice a week using light weights. Finally, don't forget to stretch. A typical exercise session begins with warm-ups and stretching, followed by the exercise program, and ending with a cool down. Fourth, pelvic floor muscle training can be performed daily. Pelvic floor muscle training can improve your health. These exercises can lower your risk of developing urinary incontinence. This is where you lose complete or partial control of your bladder. An example of these exercises are Kegel exercises. Please ask your healthcare provider for more information. Let's review. You can start exercising at the beginning of your pregnancy. Aim to achieve 150 minutes of exercise per week that can be accumulated over a minimum of 3 days per week. A variety of exercise is recommended, and pelvic floor muscle training is also recommended to be performed daily. When in doubt, ask a healthcare provider. Let's talk about some exercise safety precautions to take while pregnant to ensure the safety of both mom and baby. Avoid physical activity in excessive heat, especially with high humidity. Avoid activities which involve physical contact or danger of falling. Examples include horseback riding, downhill skiing, ice hockey, gymnastics, or Olympic weightlifting. Avoid scuba diving. Those considering athletic competition or exercising significantly above the recommended guidelines should consult with their doctor beforehand, and women living at low altitudes should avoid exercise at high altitudes. Those considering exercising above these altitudes should consult with their doctor beforehand. Don't forget to stay nourished and hydrated. Drink water before, during, and after exercise. Also, don't forget a warm-up and cool-down period should be included in the exercise routine. Next, let's talk about the warning signs that signal you to stop exercising and seek help from a healthcare professional. These include persistent trouble breathing that does not go away with rest, severe chest pain, regular and painful uterine contractions, vaginal bleeding, persistent loss of fluid from the vagina, and persistent dizziness or faintness that does not resolve on rest. If you experience any of these symptoms, please stop your activity immediately and seek medical attention. Exercising while pregnant is recommended as long as you follow the safety precautions. Please remember to listen to your body. Know when to stop and always get help from a medical professional if you have any questions or concerning symptoms. By now, you should be able to answer the following questions. Is it safe to exercise during pregnancy? What are the benefits of exercising? What are the current exercise recommendations? And how can you stay safe while exercising? We hope that you have learned about the safety, benefits, recommendations, and safety precautions in order to get you moving more and participating in exercise safely throughout your pregnancy. Please note, this video does not replace the advice of a medical professional. Ask your doctor if you are still concerned about whether you can safely exercise during pregnancy.